board-certified dermatologist from the Philippines, and I decided that I just wanted to share how to be a board-certified dermatologist, and some of my tips on how I became a board-certified dermatologist. So, number one, if you're here and you're watching my video because you're in college and you're deciding to go into medicine, or you're already in med school and then you're deciding if you want to go into dermatology, I hope this video can help you in some way or form, because the road to dermatology isn't a short one. Hindi siya madali. You really have to sacrifice for it and fight for it, and know why you want to be a dermatologist. So number one, of course, after graduating from high school, you go into college. You can choose any pre-med school course. For myself, I went into UST. I took BS Biology as my pre-med course, and then I applied for med school. Okay, so to apply for med school, you have to have, I think, an NMAT. Matagal na kasi an NMAT score. There's like a cutoff for specific schools. I can't remember kung ano yung cutoff. And then, with that NMAT score, you have to show your, of course, yung credentials mo. You apply in the med school. I applied to all med schools. Kasi lahat in-applyan ko. I applied to UST, UP, UE, FEU, St. Luke's, you name it. I think at that time, bago pa yung St. Luke's, so I'm not disclosing my age, but, get an idea, but bago pa yung St. Luke's. So, I applied to all of the schools because I was really dead set on going to medicine. Gusto ko talaga maging doktor. But at that time, I was just like considering kung ano talaga. I knew I liked dermatology because I was a very visual person. As in, I like to paint, draw, as in arts. Yun yung feel ko, bet ko yun. But at that time, excuse me, I really wasn't like 100% sure. Kasi syempre, ang goal ko was to be a doctor muna. There. So I got into UST, so dun ako na med school. So UST stands for University of Santo Tomas. If you're not familiar with that, it's in Manila. It's one of the good medical schools. Ayoko mabash. But of course, since I graduated from UST, I'm very proud na I'm a Tomasian. Doon ako nag-medicine. Kasi syempre, doon na rin ako nag-pre-med. So it was really an honor that I got accepted into UST. So, for UST, there's like 4 years ng medicine, and then the 4th year is clerkship. So, clerkship, you're basically the lowest life form in the hospital. So, uutusan ka talaga. So, at that time, yung clerkship sa amin, as in nagtutulak ka ng bed ng pasyente, tutulakin mo yung wheelchair ng patient with the oxygen tank and everything. I don't have complaints. I think that really molded us, yung generation, yung mga kabatch ko ng doctors, because we went through that. You learn to appreciate kasi you climb up from that ladder when you were the lowest, as in the lowest, nauutusan ka to suction the secretions ng patient, to collect the urine output of the patient para alam mo kung talagang enough yung urine niya for that time, to do monitoring, as in every hour, every 2 hours, every 4 hours, walang tulugan, decking kayo sa pag-monitor ng pasyente. So that was a life na you have to lead. And then yung mga kasamahan mo, like if your friends during high school, they already have a career, so ikaw, you're still studying for your career, and you will miss a lot of holidays. As in lahat, marami, Christmas, birthdays, and because of what you want to be. You want to be a doctor. Parang, oftentimes, kunyari, may birthday, dun ka na magsa-celebrate kapag duty ka. Kapag Christmas, mamalasin ka, ikaw yung mag-duty, then you'll spend Christmas in the hospital. Ganon. So, that's the 4th year ng clerkship, and then, you get to revalida. So, in UST, may revalida. Pag nakapasa ka na revalida, then they call you a doctor of medicine. But you're not a licensed doctor pa. So, the 5th year is internship. So, you have to apply for a hospital to go into internship. So for me again, I got into UST Hospital. So doon din ako nag-internship in the hospital ng UST. There's a clinical division there. I don't know if it's still called clinical division, but special charity patients. And then there's a private hospital. So we get to rotate on both hospitals. We see more patients, of course, in the clinical division, which is charity patients, as opposed to the private patients where we mostly assist with the consultants with their patients. And then after an internship, that's when you study for your board exam. So mag-board exam ka na, and once you pass the board exam, that's when you're a licensed physician na. You can choose not to go into subspecialization, but this topic is about how to be a board certified dermatologist. So, yun. So for me, what I did was, hindi ako nag-boards agad. The boards was August or February. Basta dalawa yung choices. So you can take boards agad pagkatapos mo mag-internship, or you can, like study pa or moonlight and then get the next board. So I chose to just, like get the next boards na lang. Kasi like, sobrang tagal ng pag-aaral into medical school. I just needed a break. I did not do moonlighting. Hindi ako nag-moonlight talaga. Kasi diretso na ako nagpahinga. Nag-aaral lang ako for the board exam. And then yun, I passed the board exams. Thankfully, I was able to pass the board exams. So I was already a licensed physician, and that was the time that I applied for my dermatology residency, because I realized that was really what I wanted, na specialization. During internship, clerkship, I was considering other specializations rather, like, I can't remember kung anesthesia yon. Yeah, I think I was considering anesthesia to be an anesthesiologist, and my father said na I don't think it's a good option for you kasi baka magkaroon ng parang, like, pag may problem sa pasyente or something, it's like something like that. Said my dad just told me, I think dermatology would suit you better because of the lifestyle. It's more parang as outpatient, and when you get older, you could, like venture into businesses that's somehow related to your field, which is dermatology. So, I said, parang gusto ko ng dermatology. So, I really love seeing the lesions ng patients, seeing the skin problems. Yeah. So I chose dermatology. So what institutions did I apply to? At that time, there were 10 accredited Philippine Dermatological Society institutions that were training dermatologists. So the Philippine Dermatological Society, the training for residency is 3 years. And then I applied halos sa lahat talaga. UP, UST, UE, East Ave, Hospital ng Maynila, lahat in-applyan ko. I think yung hindi ko lang in-applyan was in the Visayas, kasi malayo na, you have to go plane ride pa para mag-apply to. And then, unfortunately, I got into Jose Arias Memorial Medical Center, which is a government hospital. And backstory to this, when I was applying for the residency program, you have to submit recommendation letter. And for some reason, I was really dead set. I wanted to be a dermatologist. I asked all the consultants of UST, ng mga dermatologists, if they would recommend me. Lahat sila pinuntahan ko. I won't mention the names because I went to them. A lot of them, signed my letter. Kasi when you ask for recommendation letter, parang meron ka ng ginawa na letter. So, parang na siyang kasulat nun. Tapos you show the consultant, Doctor, would you recommend me? Because I really want to go into dermatology. And then, oftentimes they would ask, why dermatology? Ganyan, blah, blah, blah. And then, one of the consultants at that time, she told me, so where are you applying? So I said, ay naku, Doctor, lahat ina-applyan ko yan. But I really want to get into this hospital. I won't tell that hospital, kung hospital yun, but it's not UST. It's a different hospital because I like that they have lasers. Okay, sas her face, since parang gumanon siya, tapos sabi niya, you know what, you should try Jose Reyes. They're really good because they have a lot of cases, ganyan. It's a government hospital. And I'm like, ganun ba, doktora? Sige, I'll go there. And then, like, the following day, I went there. And then I was really in shock. Kasi when it's the OPD is separate from the main hospital in Jose Reyes. And then, yung OPD doon, nasa second floor yung derma department. yung pagtas mo ng hagdanan, to your left, there were like chairs already ng patients. So, all the while, I thought, mga IM ng mga pasyente yun. Kasi maraming pasyente yung internal medicine, di ba? But, I was like, super nagulat ako. Mga derma patients pala sila. And andun yung isang, si Kuya, si Kuya, siya yung kukuha ng card ng patient. Gandun yung system in Jose Reyes. May card yung patient, they give it to the Kuya, tapos sililista ka ni Kuya, and then, and then I asked, sir, dito ba yung derma department? And then, that was the first table you go after you go up the stairs. So, patient, tapos may table sa dulo. And then, I talked with Kuya, and they said, hindi, nasa loob pa. And then, they opened the door, and there are more patients in the hallway. Yung nasa loob na ng hallway are the ones who are going to go inside the actual room to be having the consultation. And dun sa dulo, meron pang more patients. And this is, later on, I found out that yun na yung para sa mga infectious na patients with Hansen's disease or leprosy, anything na infectious, like for example, herpes zoster, shingles, varicella, ganyan. It was really a beautiful experience. And, for me, who wanted to be a dermatologist at that time na talagang I was like, wow, ang daming pasyente pala ng derma. Kasi in UST, where I had my medicine and internship, clerkship, the dermatology department was a room. And then yung pasyente was in front of that room. But this one in Jose Reyes, it was literally like a hallway full of patients. And I could not, kasi siguro syempre I trained in a private hospital, and iba talaga kapag government. So that's where I applied, along with all the other institutions, which I will not get into. Basta lahat yung in-applyan ko, na-interview naman ako sa kanila, and with God's help, natanggap ako sa Jose Reyes, and that's where I took my residency, which is a 3-year training for dermatology. So the first year is you rotate in all the subspecializations of dermatology. There's phototherapy, there's dermatology surgery, there's what else? Yung contact dermatitis, and so forth. Psoriasis, leprosy, and lahat yan, iikutan mo. With the second year in dermatology, it's more focused in yung pathology. There is this thing called dermatopathology, and some patients think, or some they don't know na meron talagang ganun. Na as dermatologist, there are dermatologists who subspecialize pa in pathology, so that if you have a biopsy, dun mo isa-send sa dermatopathologist. Sila yung mag-read nung slide, and they can give you really an exact diagnosis of what you're dealing with, of what this condition is. Yun. So that's for second year. Mostly pathology yung inaaral namin. Of course, mag-rotate din sa iba, pero parang I think half of the year, you're just basically really reading these slides, and dapat pagtingin mo, what do you think? Ganun. You have like a diagnosis. You know what kinds of cells you're looking at, kung ano yung stain, ganun. And then, on the third year, yun, iikot ka ulit, but now you're mas senior ka, so technically, parang iba na rin yung workload. Kasi what I remember was, when your first year, meron pang 1 month or 2 months na rotations with internal medicine. Yun. And then, ikutan mo lahat. And then, pag third year, ikutan mo uli lahat. Derm surge, contact derm, phototherapy, psoriasis, leprosy. Yeah, that's it. So, I really enjoyed my residency on JR. It's one of those, yung parang, I enjoyed my med school, I enjoyed my clerkship, I enjoyed my internship, and I have so many beautiful memories of my residency in Jose Reyes. Because, I've met, my closest, a few of my closest friends na derma doon. And to this day, we are close friends. And, na ngayon na derma na talaga kami, when we talk about yung residency namin, sometimes it's like a bittersweet memory na you have. So, if you're watching this and you want to be a dermatologist, I encourage you to apply for dermatology. It's a wonderful specialization. If you like looking at skin lesions, hindi ka natatakot sa patients na nagbabalat from head to toe. And I think it's more a relaxed lifestyle kasi syempre, di ba, mostly our cases are as outpatients, but it does not count that we see patients as inpatients as well. But, ganun eh. I don't know, I just really feel na blessed na naging dermatologist ako. But, okay, so I'll give you a rundown of the institutions now that are training dermatologists kasi marami nang nadagdag. So, there's East Ave, Makati Med, RITM, which is in Alabang, St. Luke's Medical Center. I think noong time, yeah, there wasn't St. Luke's pa. Wala pang training at the time when I applied. UE. Okay, so no UE, I applied in UE. They were only accepting one person. And the time na nag-apply ako, for that year, they did not accept. And I can't remember why, but I still applied, and unfortunately, they weren't accepting for that year na nag-apply ako for derma. So, walang natanggap at all. And then, UST, Jose R. Reyes Memorial Medical Center, which is where I graduated from. Then, there's Rizal Medical Center, Department of Dermatology. This is a relatively new one. And then, it is, in case you want to know, it is, let me check for you guys kung saan siya located. Actually, if you just Google Philippine Dermatological Society and then yung mga information, you'll get an idea of where the institution is and what they offer, and if it suits you, if feel mo yon, malapit sa bahay mo, yan. It's located in Pasig. Yan, Rizal Medical Center, Department of Dermatology is located in Pasig Boulevard. 3rd floor, yan, Rizal Medical Center, Pasig Boulevard, Pasig. And then after Rizal, there's Skin and Cancer Foundation. So for Skin and Cancer Foundation, I think these are the dermatologists. There's a group of dermatologists, and then they train dermatologists under them, and then the dermatologists would be having a rotation in Makati, Hospital ng Makati, for more mga clinical or charity patients. For Skin and Cancer, it's when you apply, it's in it's in Medical Plaza Ortigas, Pasig City. Yan. So for clinics, they rotate in Hospital ng Makati, Quirino Memorial Medical Center, and in Makati, the Skin Clinic in Makati. What else? There's also Southern Philippines Medical Center. So those who are in the South, meron ng training for them there. For this, it's located in Davao. What else? And of course, yan, PGH. I think there are new ones pa here in the Region 1 Medical Center is also a newly training dermatology under Philippine Dermatological Society. So there are options, there are a lot. So if you really want to be a dermatologist, I encourage you to study hard. Just read the book. At that time, ang libro na inaaral namin ng medical school was Andrews. So I really read that book from cover to cover. As in, siguro I read it 3 times or 4 times. Binasa ko talaga siya by heart. By heart. And, they lifted the questions for the entrance, for the qualification exam. Kasi pag nag-apply ka sa hospitals for dermatology residency, mag-exam ka. And the questions were from that book. So yun yung inaral ko. I don't know now kung iba na. I think it has changed, or I really am not sure. But you read the book that's required for you, and then you really read it from cover to cover. Because essentially, if you're going to be a dermatologist, you're also going to read the same information, but in a different textbook naman, of course, a required textbook na for you. So yun, diba? It's a beautiful experience. And there's also, you have to go into, what do you call this? Pre-residency. So once you're accepted into the residency program, there are like a set of you will be going into pre-residency, and from there, bago ka ma-accept, mag-pre-residency ka muna. So there are like not 10 or 20, I can't remember kung ilan. Minsan may batch pa yan. And then, from there, dun nila i-decide kung sino yung talagang kukunin, i-rank kayo. So, kailangan galingan mo talaga, and mag-aral ka, kasi it's not enough to want it, kasi syempre all of you want it, all of you want to be a dermatologist, but you have to show them and you have to prove yourself that you are deserving of that slot, kasi iilan lang naman ang tatanggapin, diba? So for example, in JR sa amin, out of the many applicants, 5, tama ba? Yeah, 5 lang yung tatanggapin. For other hospitals, like for example, UST, 2, Makati Med, alam ko 2 lang din, or sometimes it's 3 yata. So, it's not a lot of slots for you, diba? And if kalaban mo is like the whole Philippines, lahat kayo gusto maging derma, marami talaga nag-apply. It's like, I think at that time when I applied, there's like 150 applicants. And yan, diba? Pinagpapalain ka. If you want it, you work hard for it, you pray for it, it will, I think you'll be able to achieve your dream. And that's it. I hope that this will be helpful to anyone who would want to be a dermatologist. Hindi naman sana ako, I don't think I didn't say anything that would discourage you. And I do hope in the future, if you are watching this and then you become a dermatologist, you say hi to me. The same way na when I see yung dermatologist na nagsabi sa akin na, uy, mag-apply ka sa JR. Whenever I see her, she's a consultant, she's from a senior talaga. So I have like this like butterflies in my stomach because, alam mo yun, parang it's like serendipity. Why would she say that to me? And then coincidentally, that was where I got accepted. Ayun. And what else do I have to say? Ayun, I would like to share na, for example nga, yan, lumabas na yung mga pipiliin for pre-res. Diba? After the pre-res, they'll give you the list. They're gonna text you or call you or kukontak ka nila kung sino yung natanggap. If you don't get accepted, don't get discouraged because I've had friends na hindi sila natanggap and then someone, parang suddenly may nag-out. May ayaw, hindi nila tinuloy. So, if you're the one next in line, you can still be a dermatologist. So, have faith, hold on to that dream. Hold on. Kapit. Para you become a dermatologist and you be one of us, board-certified PDS dermatologist. Thank you for watching my video. It's super long, but I said I wanted to share this story. And if anyone would take the time to listen to it, thank you very much. I hope I see you on my next video. Please hit the like button, subscribe to my channel, and notification bell also. Please hit that notification bell. And I hope I see you again in my next video. Bye!